So my name's Dr. Stanton Davis. I'm one of the sports medicine surgeons at TOC, the Orthopedic Center. I'm here to talk about ulnar collateral ligament or UCL injuries in overhead athletes like baseball and softball players. The UCL injury is an injury to a very strong ligament on the inner side of the elbow that goes from here to here. It basically protects the arm from over exertion or instability when a player is throwing a ball. When somebody has an injury to a UCL, their symptoms are primarily pain. They have pain on the inner or medial side of the elbow. Usually it's with throwing. And if they have pain over time, they could sometimes get these kind of injuries from an overuse injury from fatigue over time, or they'll have one traumatic event where they feel a pop on the medial side of the elbow and they can't throw, and they end up having a loss of control or a loss of velocity. So the way you treat a UCL injury is initially you try to treat it with physical therapy and conservative management. Sometimes platelet-rich plasma, or PRP, which is an injection that can be taken from growth factors taken out of your bloodstream and centrifuged, concentrating them into a gel that can be injected around the ulnar collateral ligament. That can be used to augment the physical therapy. If something like that fails, or they're an overhead athlete that requires a lot of strain to the elbow, they often require surgery to fix. The surgery can be used like old school Tommy John surgery was used. We used a graft or a tendon graft from the forearm or from another part of the body like the hamstring, or we used a cadaver graft that we used as an alternative to those grafts to reconstruct that inner side of the elbow. But nowadays we're using a technique that is called the UCL repair with an internal brace. And that allows us to put a very strong suture that's almost like a cord that goes alongside the repaired ligament, and it acts like a splint or a brace inside the skin or in the elbow so that the rehab can be accelerated. We're able to get them to return to play much, much quicker. If you have a UCL injury or know somebody who does, I'd be happy to see you at the Orthopedic Center, TOC. Just give us a call and we'll work you in.